Hello everyone, this is Yuti Doshi from One Mantra Mental. Today we have with us Dr. Minoli Doshi, and I would just like to say a few words about Minoli before we begin. She is an MBBS and she's currently a resident with SPP Hospital. She is a psychiatrist and the founder of the Mind Garage, and she likes to be called herself as a mind mechanic because I think that's what the psychiatrists do, right? So yes, Manoli, would you like to add to your work and a little bit to your introduction, please?
Yeah. First of all, hi, Yuti. Thank you for inviting me here. It's a pleasure to come here and talk to you right now. About introduction, I guess you have done it very well. Thank you so much for that. Adding up to it, I am glad that I'm here and we are here as a team to bring awareness among people about their mental health and let them know that it's okay to not feel okay sometimes and be vocal about it. So, yeah.
Okay, thank you so much. So without further ado, we'll move on to our topic. Today's topic is about anxiety during these uncertain times of lockdown and COVID-19 and how it has affected people, right? So to just give our viewers an idea, basically during this time of uncertainty, since March, since the lockdown has begun, there has been uncertainty at the topmost level in every area of lives, and it has given rise to a lot of anxiety in all kinds of populations, in children, adults, teenagers, old people, students, professionals, even the frontline workers. Everyone has gone at least once in their life, in these months, at least once, a sudden episode of anxiety or a little bit of anxiety. So that's the reason why we are going to talk more about anxiety today. So, Manoli, can you please tell our viewers what exactly anxiety means? Because we have been hearing this word a lot.
Yeah. So, as you said, that every one of us, all over the world right now, has faced anxiety in some level, maybe high, some very low, according to our coping mechanisms. So, let's try to define it, not in the textbook terms, but somewhere in the layman language. What is anxiety? So, anxiety can be thought of as a sudden response of our body to an unknown threat. The unknown thing is very important here because we know about the fact, like we have heard about terms like fear and stress too, right? So fear is basically a response to a known threat, while anxiety is to an unknown threat. So when a car suddenly comes in front of you and you're afraid, that is fear. But when you have to go to a person, when you have to face someone, when you have to talk to someone, when you have situations like COVID, where you don't know what will happen, what would be the outcome, that's when you face your mental reactions, your physical reactions. Those could be said as anxiety. So anxiety, like rather than talking about it, if we think us going through the situations like exams or meeting a new person or like having such situations where we don't know what the outcome would be, those all reactions that we face that there and then, that could be explained as anxiety.
So I'll just to give a recap. Anxiety is something. It's a response to a situation that we are not aware of. So our anticipation or something that will happen in the future. Basically, हमें जो चीज नहीं पता है उस चीज के बारे में एक रिस्पॉन्स होता है that is called anxiety. For example, as she gave an example of exams, I don't know what questions will be exams. Similarly, in the situation of COVID, हमें नहीं पता ये किस महीनों तक चलने वाला है, हमें नहीं पता स्कूल्स कब तक बंद रहेंगे, हमें नहीं पता हम जॉब पे कब जाए, हमें नहीं पता वैक्सीन कब आए. So now we, but because of these unknown, and there were so many unknown things, which has led a lot of people to experience something called as anxiety, right? Okay.
Yeah,
So,
exactly.
so what exactly happens when, suppose I am anxious? So one thing I know that if I am anxious, my eyes will become big, right? So there are certain signs, right, when someone is anxious. So what exactly are those signs or symptoms?
Yeah. So basically, anxiety starts with the mind and then it reflects over our physical body, right? So there is not a single system of our body that is not affected by it, starting from the head towards the toe. Let's start looking at as the very common symptoms that I think almost all of us know. Looking over cardiovascular system, we all have heard our heartbeats like beating in our ears sometimes. Technically, medically, we call it as palpitations, but as a normal person, we describe it as heartbeat raising, hearing our own heartbeat in our ears. Then it gradually moves towards deep breathing, shallow breathing, unable to breathe, shortness of breath, sweating, tremors, headache, body ache, as well as if it is not treated or if it is not handled properly, it can move on to symptoms like fatigue, dizziness, giddiness, and even sometimes an episode of unconsciousness could happen. So these are the common symptoms that everyone has faced. Even diarrhea, vomiting, I've seen in many people. If they are not able to handle and cope up anxiety, these are the common symptoms that we observe in the patients.
Also, I had a question here. If suppose I'm not aware that I am an anxious person generally, and I am maybe going through an anxiety related disorder, I have not treated it since years. Can it turn into a disease like a proper physical disease like diabetes or something?
Basically, seeing all of these disorders like diabetes, hypertension, all these diseases are now known as the metabolic disorders after the stress symptoms, based on the stress symptoms. So the stress and anxiety plays a very important and very huge role in manifesting these diseases in our body. So yes, somewhere it plays a role. Even if you look into the textbooks, even if you look anywhere, search for it, the etiology mentions stress and anxiety as one of the most important factor there. So yes, it obviously affects a lot, and it is a major contributor to these diseases.
So, Manoli, I think I have seen at least in these months my own family members and friends going through these symptoms. Not all of them, obviously, and I think not all of them will go through all the symptoms always. But there are certain symptoms of increased heart rate, heaviness in breathing, and things like that, and much of worrying, and it leads to physical symptoms as well. So I think here we all need to be very much aware of what the symptoms are like, as Dr. just mentioned. If you want, I will definitely mention these symptoms or make a post about it later in the caption, another post. But I one request to everyone would be, please be aware of all these symptoms. Let's not use terms like अरे यार क्या फट्टू है इतना डर गया और इतना क्या stress ले रहे हो. No, there are so many uh, misconceptions about mental health and all these kinds of reactions that we have. Suppose we both are two different individuals, and I am someone who's anxious, but maybe Minoli is not. And if I am anxious, what if Minoli said, come on, ऐसा इसमें डरने वाली कोई बात. I'm not scared, but this is my natural response. So I think this is the a high time where people start getting aware of all these symptoms. So when we talk about misconceptions, I want to know from what are the general myths that you come across about anxiety, worries, and emotions?
Yeah, very well said. And that is what we have all come across through our very close friends, our family members who come and tell us that, what, yeah, be positive, let it go, just chill. But that chill, taking a chill pill is not as easy as it sounds. So, the very common misconceptions that I have heard about anxiety, I would like to mention two or three of them, which are like very common. The first one, as you said, it's all in your head. Just take a chill pill, take it easy, let it go. But it's not that easy for a person who is going through anxiety at that moment. We need to understand that, we need to validate that. When a person comes and tells you, when a person shares with you what they are going through, they trust you there and then. It's not easy to come up and be vocal about it. But when a person comes and tells you that they're feeling that, they relies on you that you will be able to help them. So telling them that just let it go, take a chill pill, it's okay, it's easy, it's nothing, it's all in your head, that is a thing that should be probably avoided. At least try to understand, at least try to listen to that person. Especially in this COVID times, this is happening so often because people who are becoming positive, everyone will call them and tell them that it's okay, you'll be fine, don't worry, it's nothing. Or they'll be telling things like, it's all your fault, you were going out, you were not wearing mask, you might have done something. But at that point, that person is in the worry that I don't know whether I'll live or not.
Yeah,
So telling them at that moment, yeah, telling them at that moment that take a chill pill is not a thing that you should be telling. So that is a very important thing people need to understand. For your closed ones, for your relatives, for your friends that you care for, listen to them. It's not always that easy for them. There are different coping mechanisms. There are different situations, experiences people have gone through. There are different personalities people hold. And so what is difficult for you is not the same as for me, as you already mentioned that, right? So second myth that I've already like been fed up with is that you don't need medication for it, or you don't need treatment for that matter. Medication, we can understand that for mental health, people in India are still not so open to take medications for it. But at least therapy is important. Venting out, emotional ventilation is really, really important. In order to like prevent the diseases that we already talked about, it's important to take up the issue there and then, talk about it, vent about it, change your thoughts about it, have some therapy, and prevent the disorders like diabetes, hypertension that are the end results of this stress and anxiety.
right.
So that is the need of the hour, I guess.
I think I would like to add here too. I agree with you completely. When it comes to medication, if I take example from my own family also, if they have to go to the doctor for to take even normal medicines, even for a fever or something, they'll be like, "Nee, let me see for today. If it so this mindset of self-treating and waiting for the things to get normal, I think that needs to be changed. And especially when it comes to mental health, of course, yes, it is in my head, and that's the reason I need it. It's all in my head. Of course it is. But it's not helping me right now, and it's putting me in trouble, and it's making my vision unclear. That's the reason I need medicine to reduce those symptoms so that I can function properly. But I think spreading mental health awareness, that's the whole point, of inviting you over and so many others that I have done, because uh, we can talk about it. That's all we can do. But actually, someone uh, being open to take medicines or take therapy for that is when change will happen. So nowadays, many people have started doing it, but still the myths are there. And as you said, these two very important myths, when people, are I mean, they self analyze themselves and they say that, okay, it's all in me or medicine ki zarurat. Talk to a professional. See, maybe medicine ki zarurat hai. So that, I think I totally agree.
Yeah, I'd like to add one thing here. I just thought of it that also when you said that people have fever and they don't go to take the medicines and all, but then there are people who are taking a lots of medicine. If they have allergy, they'll take the medicine for a lifetime. If they have like diseases like some skin problems, they take medications for that. But when it comes to mental health, there is a concept called mental health or overthinking or anxiety or anything in that order is a weakness. It is not. It's like a high time that we understand it's not a weakness. If allergy is not a weakness, if we can understand that our body can respond in a way to dust particles in such a way that it can produce sneezing, coughing, and all the symptoms that are related to allergy, then why can't we understand that our mind can respond to the stress, to the external stimulus, to the external conditions in a way that it keeps on overthinking, it keeps on being disturbed. And let's like just be kind and understand it's not a weakness, it's a symptom of a mental disorder or a mental disease in that case.
So
So that
another
is
myth,
again
I
a
think,
misconception. Yeah.
another myth that mental health illnesses or mental disorders, if someone has them, they are weak. It's not that they are weak, as you said. It's just their reactions or responses to certain situations. And as you rightly said, we are all different individuals and we all respond to different situations in different ways. We all have different emotional capacities. Some people can take, some people are very resilient. The same situation, I might deal with it very differently and you might deal. So it's all about emotions, thoughts, how we process them, and each and every one is going to process them differently. And I think it's high time that we stop judging people based on how emotional they are or how they respond to these situations, be it men or women, because there is a lot of judgment for men too. So I think this is where we need to take a step. And these three myths, I would just like to repeat, it's all in your head. It's not. It's not only about that. You can take medicines. Mental health medicines are not going to make you addicted to them. And the third thing is that we all,
It's
I
not a
mean,
weakness.
yes, it's not a weakness. We all respond to different situations different. So these three things we all. And now that we're talking about misconceptions and anxiety, I also want to know how it, how all these situations or how our emotional responses or mechanisms, how does it manifest into anxiety? What happens exactly?
Yeah, that is a nice question. Yeah. So already we started talking about it in the last misconception that we talked, that how it is considered as a weakness. Like if there is an allergy, let's take that example only. If there is an allergy in our body, we understand the mechanism that something might have gone inside the body, our cells have reacted to it, and that have responded in certain way, and it comes up as symptoms. But when it comes to anxiety, we say that you are just thinking, you're overthinking. This is a situation and you're overthinking. But there are various steps or various procedures that are taking place at the subconscious or unconscious level in our mind, which finally comes up as an end result in anxiety. So let's try to just name a few of them. We can name it as threat scanning. Let's name it as threat scanning. So what is threat scanning? Our mind will try to see an external or an internal object as a threat. Let's take a COVID as an example. Then when we have heard of all the symptoms, when we have heard of all this threat, our mind will try to scan it and it will compel us to wash our hands again and again. It will try to think of a little fever or a little warmth in our body as COVID, a little cough, and our mind will start thinking it as COVID. So this could be said as threat scanning. This is happening at the subconscious level initially. We don't even recognize it. A person who is more anxious, more sensitive can sometimes recognize it, but it mostly goes without recognizing. Second thing that comes up is catastrophizing, making a mountain out of a mole. If there is a single symptom, if there is something like a person, a closed one is admitted, a closed one is having COVID, we'll start thinking about the end result. We'll like make up the worst situation possible in our head. What can happen to my life? What if I die? What if my loved one dies? The death is the extreme situation that we think of very easily. Even this happens at the subconscious level and sometimes come up to the conscious level that we have all noticed, especially during these times. Third one that we can mention is uh, we try to kind of fortune tell. This is mostly due to news watching, hearing people say things about things like कोविड में तो ऐसा ही होता है, कोविड एक बार हो गया तो ऐसा ही होगा, ये होगा, वो होगा, इंसान मर जाता है, सांस फूल जाती है, अगर डायबिटीज है साथ में, हाइपरटेंशन है, कोमॉर्बिड कोई भी कंडीशन है, तो बचना मुश्किल ही नहीं है। एक जन को हुआ है, सबको होके ही रहेगा। टेस्ट करवाओगे तो पॉजिटिव ही आएगा। इवन दैट लेवल ऑफ मिसकंसेप्शंस आई हैव हर्ड फ्रॉम पीपल. So that is known as fortune telling. So all these factors, when they mix up, it's not like that there would be one after the other, but all these things, when they mix up in your mind, they can then come up as anxiety, and then we see it as, अच्छा ये तो बहुत ज्यादा सोच रहा है, अच्छा इसको तो बस सोचना है, इसको तो बस हर बात में टेंशन करना है. This person has to overthink, this person will make a small thing into a very big thing. But it's not like that. It has been going on in that person's head for a lot of time before it came up in front of you. So that's how it goes on inside of a subconscious and unconscious mind before it comes up in the conscious. And then it
Now,
manifests as a physical symptoms.
and now that you have explained it, it is so much clear how we become anxious. It's basically that as simple as, basically, Dr. Manoli just explained us why do we get anxious and how the process is. There are three things basically. The first one is threat scanning. When we are constantly, whatever happens, we scan it as a threat. हम उसे एक बड़ा डर समझते हैं. फॉर एग्जाम्पल, छोटा सा फीवर एंड वी थिंक इट माइट बी कोरोना, समथिंग लाइक दैट. Second is catastrophizing, means seeing the worst case scenarios or making the situation so bad in your mind that of course it makes you tense. And the last thing is fortune telling, यानी कि खुद ही भविष्यवाणी करना और prediction, predicting that इसको तो positive ही आने वाला है. See, he was going out without mask, so of course he is going to get it positive. Or we have heard so many dialogues we have heard it from so many people around us. And we ourselves do fortune telling so many times. For example, when I was in college, मेरा exam बेकार जाने वाला है because I know how much I have prepared for. Or, there are so many examples to. So, because of all these kinds of things, there are not only three things, there are so many other, I can say, thought processes that are unhelpful, that makes us feel anxious. All these in combination. So, thank you so much for giving us this information. I am sure this will help our viewers a lot. So, when it comes to understanding anxiety, I'm sure this is going to. But what is more helpful is when you are anxious, what should you do? Right? So, for example, if I am in a situation and right now I'm feeling very anxious, what should I immediately do so that I can calm down?
Yeah. First, let us understand it in this way, that anxiety can't be avoided. Anxiety can't be stopped because anxiety is your mind's reaction, automatic reaction to the threat that it scans. So you can't say that, okay, don't be anxious. You can obviously learn how to respond to it, how to control it, and how to cope up with it. So as you asked that, what we can do at that particular moment when we're anxious, the one and the best thing that works at that moment, what we say in medical terms is acute and chronic. So acute is the emergency condition at that moment where what we require. So for that, I would recommend the breathing techniques. Let's do an experiment here. There are two types of breathers, shallow breathers and the deep breathers. So in this era of stress, in this era of so much anxiety, we all have become shallow breathers in some way. Shallow breathers are the one who will breathe fast, who will breathe short, and who will not take much oxygen in, would have more carbon dioxide in, and that's why they'll breathe fast. But we don't recognize it. Okay, so let's do this. Take your left hand and put it over your chest, and take your right hand and put it over your navel. Okay, let's take about 3 deep breaths, or rather, don't take deep, 3 normal breaths, and just observe how your hands are moving. Okay. Done? Yeah. So most of us have kind of seen that our hand over the chest moves more than the hand over navel. That shows that we are a shallow breather. If you observe a child, how a child breathes is the abdomen will come out and go in when they breathe. But when we become adult, we have adapted in a way that our chest comes out and in. Right? You're not audible.
Yes, right.
I think you.
Now?
Yeah. So yeah, it's good. So what I was saying, yes. So abdominal breathing is very important for us to relax. We were always designed in a way that we should breathe abdominally, but then we adapted and we started breathing fast so that we don't have to put on the efforts. Right? So even if you see medically, there are two types of muscles, a diaphragm and the lung muscles, or you can say the chest muscles. And if you see any textbook, the chest muscles are known as the secondary muscles, the accessory muscles. So the diaphragm, which is placed horizontally below the lungs, we know the placement of the lungs, the diaphragm is below. So when we breathe abdominally, the diaphragm moves up and down. Well, when we breathe through the chest, it moves out and in. Right? So taking out all the technicalities out and coming back to the simple steps, let's try two breathing techniques that works well when we are going through anxiety.
Okay.
The first one is breathing with 6-3-8. Okay. So when we inhale, first we need to know that whenever we inhale, our abdomen should come out. And when we exhale, our abdomen should go in. By abdomen, I mean the belly, the stomach, however we understand it. Okay. So when we take in, so 6-3-8 is 6 breaths in, 3 breaths we hold it in, and 8 breaths we go exhale out. Okay.
8 breaths.
Do you want to try it?
At the count of 8, I mean, that would be so slow. I don't know if we have that patience nowadays to breathe slow. That I think now I get you. We've become such shallow breathers.
So that is a quick fix because we are breathing so fast. There is no oxygen reaching to our brains, and that's why it is not able to think properly. That is why there is that cloudiness in our brain that doesn't help us relax during anxiety. So we can even start with a box breathing, the second method that I'm going to tell. These are the two methods, whichever one is comfortable for individual can start with that and then jump on to the second one. Both works well, both are equally effective. So first one, as I said, is 6-3-8 technique. And second one is known as a box breathing. What we do there is we have a box, a square box. We imagine a square box and we breathe for 4 at each edge. So 4, till the count of 4, we inhale. Till the count of 4, we hold. Then 4, we exhale. And then 4, we hold. We can try it right now, okay?
Yeah. I'll do the breathing.
Yes, okay. Start. 1, 2, inhale, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. Hold, 2, 3, 4. Inhale, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. Hold, 2, 3, 4.
Nice. This already is giving me a sure I'll do it at least once.
Yeah, so doing it even for 5 minutes, you can put up a timer for 5 minutes, and doing it for 5 minutes can surely help you calm you down. It helps you perceive more and think clearly. You can try it for yourself. Like anyone who is viewing this right now can try it for themselves and see it for themselves, because all these practices are not the hearsay. You can't hear it and say that, okay, this works. You need to experience it yourself to see the effects.
Thank you so much for the suggestion. I'm definitely at least once, maybe even for 2 minutes, but I'll do it for sure. And as you said, there is a lot of content available. Even I have read myself about the box breathing and the breathing, different breathing techniques. But the point is, we have to do it. that is where I think we meet ourselves, because it is for ourselves ultimately.
Yeah.
So thank you so much, Dr. Manoli. I'll just give a quick recap of what we have done overall today. We learned about what anxiety exactly is through examples and through all the explanations that Dr. We have busted a few myths about anxiety, and I hope we don't keep thinking about anxiety the same way now. We also learned what are the symptoms of anxiety and how a person looks like when he or she is anxious, and why anxiety happens, what exactly goes on in our mind when we're anxious, and how to deal with anxiety, how to settle ourselves when we are feeling anxious. So these were the few things that we have discussed today. If you have any questions relating to anxiety, I know we are in real uncertain times, and there might be so many people not having a job, for a job, uh, problem with their children, or problem with parents, lot of anxiety going on inside the house. You are stuck with people at home, and it's frustrating sometimes. So if you have any questions, if you want to talk to somebody, you can definitely DM me or Dr. Manoli and get yourself uh, your answers, whatever you need. I'm sure she will also help, and I'm also there to. And if you have any comments, you can please leave your comments below in the chat box. That's it. Just Dr. Manoli, just one last question. Do you have any message for our viewers?
Message. I guess there's one big message that I want to get to the viewers very straight. Don't be afraid to ask for help. Please don't be afraid to ask for help. Go to anyone that you're close to, go to anyone that you are free with. I just read a quote. It said that you are like a soldier on the wall fighting at a battle. Then why are you afraid to ask for help from another peer soldier? It's exactly like that in life. We are a human, another one is a human. If you are going through something, just feel free and go and talk to someone that can help you. That's
Thank you so
it.
much
I
for
guess
that
that is the
message.
big message that I want to give.
Thank you so much. I think what Dr. Manoli is trying to say here is stop judging yourselves and judging others. I think that's where that would be a very big step towards mental health awareness. So, yes,
True.
I think we end it here.
Sure.
Thank you so much for coming, Dr. Manoli. We loved having you here.
Thank you for inviting me. It was a pleasure being here.